Hi, I'm Dr. Joanne Franklin. I am not a physician. I'm an advanced practice registered nurse with a doctorate in nursing practice. I would like to tell you about the grant that we have with the University of Missouri in Columbia at NHC in Desloge. There are 4 goals to the grant. The grant looks to reduce hospitalizations by recognizing illness early with Interact tools like Stop and Watch and S-bars. Also, we have reduced polypharmacy, which according to CMS is 9 medications, more than 9 medications. In addition, we have reduced antipsychotics in dementia, and actually at NHC in Desloge we use no antipsychotics in dementia unless someone has a psychiatric illness. We also have started conversations about advance directives so that we know what people's last wishes are if they aren't able to speak for themselves. The University of Missouri's grant involves 16 nursing homes in the state. All of those nursing homes have APRNs in the home 40 hours a week to follow these 4 goals. The University of Missouri grant has kept data which is reported to CMS, and we do report that on a monthly basis. The grant demonstrates that NHC in Desloge is a leader out of the 16 homes. In addition to that, there are 7 states throughout the country that also have the same goals. They do not have the same format or have an APRN in them 40 hours a week. And because of Mizzou having APRNs in the home 40 hours a week, they actually have led the grant over the 7 states, and NHC in Desloge has led the state of Missouri, which means that they are leading the nation. NHC has values and relationships that are important. The reason that our grant has been successful in NHC in Desloge is about relationships. We have an excellent administrator, Jackie Podlowski, who has diligently gotten people to be on board with the grant. In addition to that, our leadership team is really successful. We have Tim Francis, who is our DON. We have Melissa Doyle, who is our quality assurance nurse, and also Amanda Kreitz, who is our MDS coordinator, and Angel Pritchett, who is our social worker. And this group collectively has been able to implement all of the grant goals, and we have been successful in doing that. One thing that we know that is important is level of education, and we have tried to implement bringing everyone's education up. My title actually for the University of Missouri is as a clinical instructor, and so part of our job is to keep education ongoing within the home. The one thing I would like to share with you is that nursing homes are not what they used to be. There are not little men and women walking around. They actually have very acutely ill people, and so we need to invest in education in order for nursing staff to understand what kind of critical thinking skills are needed. So when I first came, nursing staff would ask me what to do if someone had a change of condition, which is what we record. We also look at medication reviews. And by having changes of condition and nursing staff recognizing those, they weren't really sure what they should do in those situations. So originally I would have to tell them that we need to do stat labs, and we would do complete blood counts, we would do complete metabolic panels, we would order stat x-rays of chest x-rays if we thought they had pneumonia, or KUBs, which is of the belly, if we thought they had some kind of problem with their stomach. We would go ahead and have those ordered, but I would have to direct nursing staff how to do that. And now what's occurred is that nursing staff has actually recognized those things. So instead of me spoon feeding what they should be doing, they actually call me and say, okay, this is what I have, and this is what I'm going to do. Are there any other suggestions? We do skills demonstrations for pericare, for transfers, and those sorts of things. We also have monthly mandatory education that involves all nursing staff, CNAs, LPNs, and RNs. In addition to that, we also invite other staff, such as housekeeping or secretarial staff, or anyone in the building is welcome to come. We usually, during monthly education, we focus on a particular topic. It might be something that we've had an issue with. For example, when we had our survey this year, we had a medication crushed, which was not supposed to be. And our other survey problem was that we were not posting staffing publicly. But those were really the only 2 tags that we received, and that was only 4 points in the scheme of things. We also use Hand in Hand, which we are now doing monthly. All nursing homes across the nation receive the Hand in Hand program to be able to teach people. It teaches people how to deal with people with dementia on their own terms and not to medicate them with antipsychotics. Staff was nervous when we talked about taking antipsychotics away in the dementia unit, but what they came to find out was that people who were not sedated actually could feed and toilet themselves, and they could actually know the person themselves and let them be able to do what they liked. In addition to that, the thing that I think I'm most proud of is that we haven't used any antipsychotics in dementia on our dementia unit or throughout the building if a person only holds that for a diagnosis. Our Interact tools have been significant. Whenever you use Interact tools and recognize illness early, such as the Stop and Watch, which is an acronym, like the S stands for seems different than usual, the T is talks less, and as it goes down, there are different areas and systems. So using those tools can be used by anyone, housekeeping, dietary staff, nursing staff. And when we use those tools, we find out that by implementing them and increasing the number of Interact tools, it decreases hospitalizations. S-bars are used by nurses, and they're a communication tool to use when they call a physician. And it makes them look at labs that have been done, medications that have been given, diagnoses, and they do a whole assessment before they decide what their diagnosis is and before they make a request. It used to be that our slogan was, when in doubt, send them out. And now what we try to do is, when in doubt, fill one out before they call the physician. Before they also send someone out on a transfer to a hospital, they must contact one of the on-call nurses, Tim Francis, the DON, or myself. We are available 24/7, and we want people to call because we want to reduce hospitalizations. We have successfully reduced hospitalizations, and in the month of February 2016 and also in January of 2015, we had absolutely no one transferred that was in long-term care to the hospital. We have found that our outcomes demonstrate that the more Interact tools that are used, the better outcomes we have. CMS was so pleased with the success of our grant that they have asked us to do phase 2, which would be another 4 years. We have to have qualifying diagnoses. We will be paid to keep people in-house for those diagnoses, which are pneumonia, CHF, skin issues such as infection, dehydration, COPD, asthma, and urinary tract infections. Both physicians and nursing homes, when they're involved in phase 2, will receive a special code which will be used to increase income for those 6 diagnoses. And we have been very pleased with the level of care that nurses have been able to bring. And the educational level of the nurses has excelled, and they are all very interested in learning. We do talk about different changes of condition, particularly the ones that will be in phase 2, and those things have been reviewed with nursing staff through PowerPoints. We have nursing staff give information every month, and during our nurses meeting, we go over those different illnesses so that everybody's on the same page and knows what kinds of things can help our patients be able to stay in the nursing home, and the residents can stay where they live. It's a much better place than going into a hospital environment. So I would like to thank NHC for giving me the opportunity to share the University of Missouri and Columbia's grant with you all. I would also like to thank Judy Powell for her support and thank NHC for the opportunity that I've had to be a part of this wonderful center. Thank you so much.